I got it. All right, I got it. So we're recording.
Can you see that?
Barely, but I know it well enough. So for 2022, hard to imagine, we have some fabulous speakers coming. One is David Anderson, who is a psychologist and an expert on behavior management for ADHD. And he'll be here on, is it January 3rd or January 10th, Joni?
The 10th.
I think so. He'll be here January 10th. The next month, February 7th, Stephanie Sarkis is coming, and she's going to be talking about gaslighting and how to recognize and shut down that kind of abuse. And she's a wonderful speaker. And then in March, we are having Deborah Goldberg, who is a registered occupational therapist who's been doing this work for years. I've worked with her. I think Andrea has. Joni, I don't know if you've ever worked with her. Bella has. She really understands kids and looks at them not just from a classic OT perspective, but sensory integration. She's trained in, she taught me more about zones of regulation. So we are having her speak. We are not 100% sure what she's going to be speaking about. But if you check our website, and you should get announcements, that will be coming up soon. We also have support groups. The first Monday of every month, it's the third Monday, I'm sorry, of every month, from 7:30 to 8:30. There's a support group for adults run by Isabel Ibrahimi, and her email is there. You would contact her if you're interested in attending that. And then we have two parent support groups, one for pre-K through 6th grade, and that's the second Wednesday of each month, run by Joni Korn, and the fourth Monday of each month for parents of 7th graders and up, also run by Joni. And just contact Joni. You'll see the email. Her email address is right there. And if you have any other questions or things you want to hear about, maybe we don't have a speaker for, but you're interested in, please reach out to me at adhd.bergencounty@gmail.com. And if you can, visit our Facebook page. It's in the development process. So we would appreciate any suggestions. So without further ado, I want to welcome Dr. Jeffrey Katz. Jeffrey Katz is a clinical psychologist who works with children, adolescents, and does adult ADHD evaluations, as well as working with parents. He's been involved with the ADHD community for years, is on the board, and also happens to be my brother-in-law. So Jeff, I'll let you talk more about yourself and what you do. Tonight's presentation is about 504s, working with child study teams, IEPs, and we hope you bring lots of questions. Jeff has a lot of information and a lot of experience being at child study team meetings, 504 meetings, and helping people advocate for their kids. So no further ado, Jeff.
Thank you. And can you all hear me?
Could you be a little louder?
Can everybody hear me?
Yeah.
Yeah, good. So my name is Dr. Jeffrey Katz. As I say to the kids I see, you can call me Dr. Katz, Jeff, or Jeffrey. Just don't call me Sam. And then the more oppositional kind of ones, the fun kids will say, okay, Sam. But I'm pretty sure by the next time we get together, they're going to remember who I am just because of the introduction. So that's always a nice thing. And I'm going to actually share my screen, and you will see me over here. And you can see it says section.
Jeff, you just muted yourself. You need to unmute.
Sorry, my finger slipped. So I appreciate the introduction from Ellen. We have known each other for a long time, and, and it's been very, very nice. I'm going to talk about Section 504 and certainly about IEPs. Also, the issues about advocating really for your child in the school system. I am a co-chair of the CHAD Public Policy Committee. I don't know how much you all know about how CHAD operates, but there's only very few committees. And myself and my co-chair, Ingrid Alpern, know that the Public Policy Committee is probably the most important committee. We generally work on the federal level, and what we follow is public policy. And you're going to see that, for example, I'm going to refer to the resource guide for ADHD, which was published and put out by the Office of Civil Rights at the Department of Education about 5 years ago. They sent this out not to change about what Section 504 is, but specifying to schools what they're supposed to be doing. And that came about because we had done a survey of the membership of CHAD. We knew there were a lot of problems with Section 504 and the way it was being used by the schools, and still are a lot of problems. And over about 3 years, we were their consultants. So we'd get a call from them about once a month, once every couple months saying, can you tell us about this? Can you get us information about that? And that's what we would do. So it turns out that we had quite a hand in this. And by the way, every school system, every school in the country got a copy of this guidance. And I'll show you where you'll see it. So we do a lot of things in terms of educational issues. One of them we're looking at right now is you have Section 504, which is for obviously kids, who have some kind of disability, but it's not specified when they get a Section 504, or at least there's no statistics taken as to how many have to do with ADHD, how many things have to do with a broken leg, or other things you might get a 504 for. So one of the pushes is that we want to get ADHD specified in a way that we can get data on how it's being used, because we're pretty sure, and there's some research that backs it up, that there's certain communities that there's not a Section 504 in the school system. And we're pretty sure, and there's research to back it up, that disadvantaged communities have lower numbers of Section 504s. So it's being used differently in different areas. Another one is similarly with IEPs. You can have an IEP for a student who's ADHD under OHI, other health impaired, and there's no collection of any kind of data about how many OHI IEPs are primarily because of ADHD, or even secondarily have an ADHD diagnosis on it, or eligibility on that. And these are things that without this kind of data, it's then becomes very hard to influence further how these things are done for ADHD. And I just hit something and I forget what I hit. Oh, here I am. So I am on the Public Policy Committee. I'm also on the Board of Directors, second time around, which I enjoy. And I'm also on the Professional Advisory Board. There are not too many people like me on the Professional Advisory Board. Most of them are either physicians or psychologists who are involved in research. And I'm not an academic. I'm not involved in research. So I'm kind of feel good that I'm a clinical psychologist. I'm in private practice, but they see me as having important information. And actually, I'm the one who probably gets the most out of it because I learn from all the experts. So that's a good thing for me. Now what I'm going to do is this is the next one here. And I want to show you this one. So I had just mentioned the resource guide for students with ADHD. And I don't know if you can screenshot this, but if you don't get this down, I will be able, you can email me and I'll send it to you. But the United States Department of Education, Office of Civil Rights, has a resource guide for students with ADHD. It's very well written, and it really it tells you what you need to know. I assume you all have an interest in this, obviously, and we'll have time for questions in that for sure. But a couple things. For example, it says that if there's a child who's gifted, identified as gifted, and is getting straight A's at school, they could be entitled to accommodations for ADHD to cover what's happening at home in terms of homework, if there are issues. So it's a very powerful document. And they also say that if somebody has a diagnosis of ADHD, it is understood that there is impairment. In other words, that it's recognized that having the diagnosis itself means there's impairment at school, because that's part of the criteria for diagnosing somebody with ADHD, that there's significant difficulties in 2 or 3 different areas: home, school, or the community. And generally it's home and school. So it's a very important document. Now, the way I've had written up this presentation, I go through a whole lot of stuff about how the document came about and these kinds of things. But I realized more recently that the truth is nobody's interested in that stuff. Well, no, maybe you're interested, that's okay. But that what people are really interested are in having a meeting, and how do you get through a meeting, and how do you get what you need, and what are the kinds of accommodations that are really important. So I'm going to play with this for a second. I'm looking at the taskbar. I don't need that. But what I want to do is to get to the end, towards the end of this, and I'm just going to do this, okay? And I will let you know when you can look again. And almost here. Almost here. Okay. Well, now I'm going to go back a little bit, and now I have to figure out how to go back. How do you like that? I'm sorry. Maybe Rachel, how do I go back? Rachel.
You want to go back and press
Yeah, if I go back
the
slide.
escape button.
Oh,
Back button. So, okay, yeah.
I got you.
that worked, yeah.
And I'm just going to move this over a little bit. And I'm just looking honestly to see which way to run this. Okay, so we're going to go over here and go to right here, and let me see. So, and then Rachel, if I need to go to slideshow, right?
You're already there, so now press all the way to the left where it says from current slide. Yep.
Okay.
You got it.
Okay, you see that now? Okay, so let's talk about the Section 504 plan. And I want to say that this would also fit very much for a youngster who has ADHD as well as an IEP. It's really the kind of the same process from what I have found. To me, I'm a psychologist. I see a lot of kids, a lot of teenagers, a lot of families. And I actually had the opportunity in the last month to bring this up to a number of national organizations because I can see kids over the summer and they do pretty well, right? But when school starts, within about 2 weeks, the kids are stressed out, they are depressed, they're anxious, there are family problems all over again, and it's all about school. And it is about school. It's not about, I mean, when you talk about ADHD, medication can be very, very helpful. There's no doubt about that. If I see a kid I think has ADHD, I'm recommending doing a trial of medication at least. You need to figure it out. And you can have really good behavioral interventions and family interventions. But if you don't deal with school, the place the kids are for most of the day for months, and has such an effect on their self-concept, their self-esteem, and their ability to learn, you're missing the whole point. So it's interesting that the CDC does not collect information about school and 504. There are other groups that have guidelines for assessment and treatment of children. They do not deal with the schools. And I do say to parents that I do believe teachers want to do the best for your kid as they can. I believe that. It doesn't seem like that sometimes, but I believe they do. I think the problem is they don't understand your kid. They don't understand what the problem is. To them, either ADHD is, or all kids are like that. He's just having more problems, and this is 12 years of problems or whatever. But I think they want to do the best. They just don't understand your kid. And that's part of the thing with 504, for example. And when parents, because I'll go to meetings with parents and I'll say, if the kid doesn't have a 504 or their problems, I'll tell them it's going to be 2 meetings at least 2 hours each. Because the first meeting is helping the school to understand what the problem is about the ADHD and anxiety or whatever else might be there. The second meeting is about putting together the plan. So as happened last week, the school says, oh, we're setting up for a meeting from 11:50 to 12:20. I said to the parents, no way. You tell them that you're not going to schedule multiple meetings. You need a meeting for 2 hours. And hopefully it won't take that long, but that's what we need to have, and that's what we did. So when you look at designing a Section 504 plan, what are the students' difficulties? If they have ADHD, we all have some idea of, basic, inattention, hyperactivity, impulsivity. But it's really about what are the problems they're having in school right now. They're not turning in their work. They're overwhelmed with their work. They're disorganized. They talk too much. They blurt things out. They get into fights. Any of those things you could identify as what happens with ADHD. So I saw in an IEP about, what's the kid's problems? Well, he's defiant. He doesn't do what he's told, and he never turns anything in. And that's kind of what the school was saying. These are the problems and why he has this IEP. And I said, no way. The issue is that they have diagnosed with attention deficit hyperactivity disorder, and it's manifested by these behaviors. The difference being that it's not that he's defiant or these, but because of the ADHD symptoms, this is the way he's acting. Because otherwise, that school, they considered the child to be a behavior problem. They did not, even though the IEP was for ADHD, they did not understand the ADHD. And it was very important that they understand that those things are a direct result of the ADHD. So how do we consider the problem from an understanding of ADHD? Oftentimes when the child's defiant, it's because he's not doing well in school. He's overwhelmed, or he's not getting support for problem areas like writing, which is a big one for kids, or they don't get enough time. But you have to, if you've listened to Ross Green, kids want to do well. Kids want to be loved and liked. And why would a kid have these kinds of problems? They don't choose to not do stuff. There's something going on that's making it not work. So we have to understand the problem from the understanding of ADHD, and then we design accommodations and interventions also from an understanding of ADHD. So when they say, well, we'll just give him extra time, it seems like it solves the problem. But what does that do to a kid who's ADHD? What is it, December now? They'll still be doing their December work in February, still trying to get the other work done. It doesn't make sense. Or schools will say, well, he needs to keep a planner. Oh, that's wonderful. I've seen adults with 5 different planners. The problem is they know they need to keep the planner, but they don't do what they need to do at the time they need to do it. It doesn't work for them. And the whole point of The IEP with accommodations and goals, as well as a 504, is how do we support the student so that they're mastering the information that they need to master, and that the disability is not affecting them, or you're minimizing what the disability is doing. So you have to understand how ADHD works to know how you can best work with it. So you do want to gather evidence. And to me, evidence is, I get teachers to fill out behavior rating scales. It used to be, oh, they were so excited. The kid is going to go see Dr. Katz. That's wonderful. And then it came back to bite them, but most teachers still do this anyway. They'll still put down all the problems. Well, he this and he this and he this and that. Great, because then we can say to the school, what are you going to do about it? So we need evidence. We need to see, or it could be school records, or, you know, and I as parents, anything that's coming up that's problematic, I mean, you can put in positives too. You want to keep a record of these things, right? So that you have it right in front of you in a meeting. And to whom is, yes?
Can I interject? Can you, in your examples, can you also talk about examples of female presentation and maybe some inattention, disorganization, and that?
Yes.
Because I know a few people here who have people
Yes,
like that.
absolutely. So, you know, the kids who are more of the inattentive side, often slow moving, lethargic, spacey, daydreamy, and they can behave very, very well, but they're the wallflower, right? And in all the kids, you know, who are ADHD, you know, you'll hear it over and over again. Well, they know how to do it. Well, she pays attention sometimes and gets it done. She's just choosing not to. But that's what ADHD is. It is inconsistent. So when I talk about impulsivity, or, you know, these other things, and Rachel's absolutely correct. The saying is, if you know one person with ADHD, you know one person with ADHD. Everybody with ADHD is different. You know, everybody is different. So all of these things are going to apply also, though, to kids who are more of the inattentive type. All right. To whom's the request made? Usually it's to the assistant principal. Down here, I'm in Virginia Beach, and there are a number of cities around here in Virginia Beach. The request goes to the counselor. In Chesapeake and Norfolk, it goes to the assistant principal. You say you want to, you know, you're concerned about your child in school, and this is what the teacher's been saying, and you want to have a 504 meeting. And if they say to you, well, why? I just told you, my child's having problems. They have ADHD. You know, the problems. Well, what do you want us to do? And I tell you, don't answer questions like that. That's the point of the meeting. You know, you're not saying to them, oh, you want to have a meeting, and this person is going to make a decision about whether they want to have a meeting or not. You have a right to have a meeting. For 504, just like with an IEP, if you made a request that you want your child considered for special educational services, they're required to meet with you within 10 business days. And you should know that what we're talking about is federal. It's on the federal level. States cannot change some of these regulations and laws. So what I'm saying to you is going to fit wherever you're at, okay? So that's who the request is made to. Who do you want to invite? Certainly the teachers, and they're going to invite who they invite. People who know the child well, if you have a therapist or somebody else who works with your child and knows them, last year's teacher maybe. You might invite them also. I'll tell you the other person I get, because I say to parents that what you want to do is you want to train the school. If your child's starting in kindergarten and they're going to be there for now another 6 years, you want to train the school on what your expectations are. So you should get to know people. In our area, and I'm assuming it's everywhere else, each of the school systems has people who are coordinators, either Section 504 coordinators, or they are special ed coordinators. And these are not the ones internal to the school. These are the ones who are from the downtown office, and each of them probably covers a few different schools. And I've become friendly with them, and I invite them in, or I have parents invite them when there's a problem at the school. And what's good about these coordinators is they're really compliance officers. Their job is to make sure the school is complying with Section 504 regulations, as well as complying with IEP special educational things. The other advantage to them is they generally know more about ADHD and other issues, and about accommodations, and how to build a good IEP than the people at the school. And part of that is they're responsible for a number of schools. They know how it can be done in different places. So when you get one of them into the school and you say, well, I want the teacher to meet with my 13-year-old each week to go over how he's doing and the work. If the school says, oh, no, we don't do that, the person can say, oh, yes, we do, and that's doable. Now, you see here, the other thing is probably not your child, at least not at first. Schools will often want to have your child come in, particularly if they're a little bit older. My experience is not a good thing, because they're going to look at the child and say, now, Johnny, or we can say little, what's a good girl's name? Jana, my daughter's name. Jana, now you're supposed to get your work done, right? And we try and help you with this, but sometimes you don't write down the things you need to write down. Is that right? Yeah, right. You don't want to put a kid in that situation where they're having to be questioned by all these people, because what's the kid going to say? Yeah, I know I'm supposed to do this stuff. But that's not the issue, because any of the things we're talking about is not about what the kid is supposed to do. It's about what the teachers are supposed to be doing to support the kid. And I say at least not at first, because the other thing is, by the time I get done with the parents, I'm sorry, I shouldn't put it that way, but parents are angry with the school, because the school could have called the meeting. That's what the regulation says. The school could call the meeting if there are problems. In fact, they're supposed to child find. They're supposed to find the kids who are having trouble. So if the kid is not getting good grades, but everybody knows they're smart, and the school hasn't requested a meeting, that's their problem, right? But you have the right to have that meeting, and you can be angry with them that they didn't do it. So usually the first meeting is not a good one, at least because I don't want kids to see teachers and parents kind of going at it with each other, right? Maybe another meeting, once everybody's agreed on what the problem is and what we're going to do, then bring the kid in. There's no problem with that, but not when people are at odds at first. The other thing is I record every meeting I go to, every single meeting. Maybe once have I had to go back to that recording because it was really important to demonstrate to the school that this is what you said. But that's what you get when you record the meeting, is you're going to have a record of what people said, not just the written one. And you can go back yourself and listen to it if you want to make sure, did I hear that right or not? They are not going to object, because you have the right under the law to record that meeting, audio recording. If you want to record it, I encourage you to let the school know ahead of time, a day or two ahead of time of the meeting, that you're going to record the meeting, because then they'll want to record it. They don't. They're just going to want to record it themselves, and you don't want them to be running around looking for something to record it with. So recording the meetings are very important. How to run the meeting. Don't be the first to speak. Every single meeting I go to. So, Mr. and Mrs. So-and-so, you're concerned about your child. What do you think the problem is? What's the matter? What would you like us to do? If you start speaking, the school they're going to shut you down. Oh, yes. Oh, yeah. We understand that for sure. Have you taken them to see about medication? And all of a sudden, the teachers, everybody's problem solving their disorganization, or they just pass over what you say. Don't be the first to speak. And I interrupt meetings. I mean, I'm gotten to a point where I feel pretty good about what I'm saying, and I interrupt the meeting if they ask the parents. Actually, parents, I tell the parents before the meeting that if they ask you, why you called the meeting, if you don't keep your mouth shut, I'm going to kick you in the leg. You know, don't speak. And what I'll say is, well, I really appreciate that, but I'd really like to hear from the teachers, how are things going? Oh, and they will do that. Because if you get the teachers to speak, what you're going to get, hopefully, is the same stuff they put on the different rating scales you've done, or you know, the stuff that you have from them sending you multiple emails. Well, you know, nice girl or nice boy, he doesn't pay attention, and because of that, he misses the instructions. Now, I tell him, do you understand the instructions? And he says, yes. But then, you know, half an hour later, he doesn't know what he's doing. Now, where was the teacher for half an hour? They didn't get to the kid in the first place. Or, you know, well, he speaks too much and he's not paying attention. He's bothering other kids. Let the teachers tell you what the problems are. It's all recorded. And then you can say, I appreciate all that great information. By the way, the other questions you want to know, well, like you see there, so he's getting, I'll brag about my younger daughter. When we had this meeting, the Spanish teacher said, she is a great student. She's a straight C student, really good. And we're like, what? Straight C's? That's not my Jana, right? And the question is, well, how do you, what is she getting, you know, is she getting, is the grade she's getting, is she doing as well as she can in your class? That's the question. Is she doing as well as she can? Well, no, not really, because, you know, she loses points when the stuff doesn't come in on time or they don't finish the test. They're not doing as well as they can. And by the way, that's a very important question, because what you're showing them is that the problems with ADHD are affecting them in school. Where this kid I saw today, and we had a meeting, he's having big social issues. No, he makes friends and people seem to like him, but in these unstructured times on the playground, he's complaining that he's getting bullied, and kids are complaining about this or that. But we know he's a nice kid. Well, there's something wrong then, right? So you want to know if they're doing as well as they can. You want to know what they do well. That's important too, because oftentimes an accommodation is going to be make sure that they're doing something that they can show themselves as contributing to the class, that they're not this person who keeps getting talked at, but that there's some good parts to them. And then how do they get along with the other students? Very important, because the school may say, and that's what the resource guide for ADHD said, it's not about just the academics. It is their functioning in school, how they get along with the adults, how they get along with the other students, all parts of their life that are related to school can be addressed here. So you want to know how they're getting along with other students, because you do want to know what are the kinds of things that they maybe need. What do this, and like I say, don't do the problem solving for the school until they understand that's their responsibility. So the question to the school, I did this today with this kid, and I appreciate they think I'm a great psychologist and I have all the great answers. Doesn't matter really what answers I say, because if I bring them up first, then they can just shoot them down for different reasons. Well, we can't do that, well, whatever. I want them to come up with the ideas. And part of that for me is that if we talk about it enough, they'll start coming up with the ideas themselves. And then it's not for me, they're doing the good job there. But I want them to know that it's their responsibility, because you can talk to your child at home all day long about paying attention. You can talk to them all day long about when you go to school tomorrow, remember when you get there, put your jacket in the thing and start the morning work. And what's the kid going to say? Great. And what's going to happen the next day? It's not going to happen, because what happened, the thing about ADHD, the kids are so much in that moment that they're not going to remember those things. That's where they need that support. As I said, train the school to your expectations. Whoops, oh, look at that. Where was I? We did that one. And we did that one. Oh, train them to expectations. You cannot, as a parent, you cannot solve the problems that they're having in school. And that's what I meant. Whatever you say to the kid, and it's, you're not going to do it. And the same thing to me, it's not appropriate if the kid has a problem in school or misbehavior in school that they come home and then get a negative consequence for it. Sometimes you do, but for the most part, if it's happening at school, again, you can give a consequence to the kid all the time, but that doesn't mean it's going to be better in school. You know, you're not in charge of the school environment. So for me, if there are going to be rewards for good behavior, the school should be doling them out. They should be giving homework passes or, class assignment, passes that they can not do if they get this and that done. And you require the help of the school also to deal with some of those problems at home. It's not about what your child is supposed to do. It's not about what you're supposed to do. The 504 plan is about what the school is to do to minimize the difficulties the ADHD is causing. And then at the end of the meeting, you want to set up the next meeting. I never leave a meeting without saying, well, I'd like to get the next meeting set up. It helps me to clear, my schedule out to make sure I can be there, because you don't want to wait till there's a problem to have another meeting. And also you're going to, particularly if you are in middle school or even high school, there are many teachers there and not all of them come to the meeting. So you can set up a good IEP or the 504, but you're going to find that some teachers don't get it. I've had teachers say, kids on the IB program, we don't do that. Well, sorry, yes, you do, right? They have to. So there's going to be problems. And the idea with the accommodations is not that everybody's going to come up with the accommodations that's going to work for this issue. In psychology, it's a lot of experimentation. We're going to try this is what we think is going to work, and maybe it will, maybe it won't. If it doesn't, that's fine. We have learned something about how the kid operates. So we need to modify the accommodations as necessary. So I say set up the next meeting. Maybe it's 4 weeks, maybe it's 6 weeks. Sometimes you want to make sure it's a few weeks before the end of the quarter, because if the kid's grade is low, there may need to be an accommodation about retaking tests or whatever things. But you want to set up that next meeting. Listen, if everything is going great, the parents can cancel the meeting. But if things are not going great, you want to know it. And even if you set up the meeting for, if you want to set up, the meeting and things are going well, you can still always get together for a short period of time just to say hello.
Hey,
Ellen,
Jeff.
yes.
Oh, sorry. Can you also, it may be in an upcoming slide, talk about the teacher's responsibility to meet with the student as part of perhaps their 504 plan, and how the use of check-ins and scaffolding can help those inattentive kids?
Yes, and you may need to do part of that for me, but that's okay. I see in the chat here, it's a resource guide required to be handed out by schools for parents of ADHD kids. No, what the schools are required to give is their, it's what the, it's a, not an outline, but they're supposed to give the regulations, what a 504 is about, if you disagree, what do you do? Those kinds of things. But they're not required to hand out the resource guide. But if you give me, you can either go to the OCR, or I have it on my computer. I can send it out to whoever wants it, and you can go to the OCR and get it. So set up the next meeting. So let's go to the next slide. Why do we have, here's my general list of accommodations. And why I say a general list of accommodations, I do a lot of reports. If anybody wants a job doing the writing of reports for me, just let me know. I'd be a much happier person. But so I say my general list of accommodations, because I have like 3 pages of different accommodations that I've used. And so when I do a report, I always look back once again, what did the teacher say in those report forms? What are the things that the teachers pointed out? Then what did the parents point out? And I want to bring all of those things into my list of accommodations. So I have this list and I pull from it. And you're going to see that some of the things are rewritten a number of different ways, just based on kind of what was going on and how I wrote it. But you can see one of them in general is the results of evaluation illustrate the impact of Jack's ADHD on his academic functioning. Therefore, accommodations are recommended to minimize the negative effects of his ADHD, to facilitate his learning, and to facilitate his demonstration of his knowledge. And that's essentially taken from the regulation. That's what accommodations are for, so that he has access to his learning and that he's able to demonstrate it. So here's another one. So Will has significant difficulties in such areas as concentrating with his executive cognitive function, considerable restlessness, social skill deficits, and behavioral difficulties. In the Virginia Beach, I'd like to think that I'm responsible for all this stuff. Probably not. You can get a 504 without a diagnosis of ADHD. But if people are pointing out that their youngsters' working memory is poor, and I'm going to plug this in before it gets plugged out. Here we go. If all the teachers are saying, his working memory is poor, and he could do so much better, and he's not concentrating very well. In Virginia Beach, if they have enough that information, they'll have a section 504 written. Because in the regulations 504, executive cognitive function and those kinds of things are there. So they can write a 504 without even having a diagnosis. I think the diagnosis is important because it says some more things about what they should do. And then you'll see here, modifications of policies, practices, and/or procedures, such can be provided through accommodations will facilitate appropriate functioning at school. And then related aids and services can teach Will the skills and strategies he needs to learn in each of these areas. Yes, I see that Jack became Will. I'm sorry. And what's important about this is they'll tell you, we can't do that because we can't modify the curriculum. The curriculum is, we have to teach the curriculum. And that's true. And that's not what we're trying to do. What we're trying to do is to change some of the practices or procedures that can be done through accommodations. Related aids and services are even under Section 504, your child can get occupational therapy services. They can get assistive technology. They can get LD resource services. Anything that child needs that is going to help with the disability for the child to do well as they can in school is available under Section 504. Now, if you start asking for, a LD resource teacher, if the school is smart, what they'll do is say, well, let's also refer him for special educational services and let them do an evaluation. And the reason being is, from the school point of view, is we're given money from the government, federal government, to provide special ed services. There's money to hire teachers. Section 504, there's no money involved. It's supposed to be things that can be done in the school system, within the regular classroom. So if they're smart, they'll say, look, let's keep the 504 going. Let's go through eligibility for special ed, and then we can get all those things, and you can have the accommodations. So, but you should know, and in fact, during COVID, when the kids were at home, it was very interesting because what the Department of Education said was that schools have to apply the accommodations that they have there. They still have to do their job with kids with disabilities one way or the other. And what that meant was, I'll show you in a moment. So it's important to remember ADHD is a disorder of performance, not ability. So for example, Jack would be able to say what he needs to do to organize his notebooks, and he could do it with supervision, but his ability to maintain the organization on his own is compromised. He could say what the long-term goal of a project is, but his ability to carry through the steps required to reach that goal are much more difficult. I don't put this all the time, but here's a good one. it's most important that the frustration that Jack experiences because of his ADHD be minimized so that he enjoys school and learning. Accommodations should be designed with this purpose in mind. There's a difference between frustration and struggling. Struggling can lead to growth. Frustration is going to hinder the learning process. And if you're most concerned about anything for your kid is that they're not going to enjoy school. That's a problem. They need to enjoy school. So this is kind of what I came up with. And I know it got appropriated by Virginia Beach Public Schools because they started telling me this one when I knew it was mine in the first place. It's recommended that classroom teachers conference with so-and-so at least weekly to review their grades, focusing on the reviewing assignments completed, monitoring progress on assignments due or missing, and planning out next steps for completion and updating classroom structure. And the second part of that is modified grading. It is recommended that the focus be on the mastery of the information being taught rather than the amount of work that is completed. It's recommended then that assignments be modified so that they're only spending as much time on them as their peers. That's, we're going to level the playing field here. Assignments can be modified in regard to length, the time they take, or the mode in which they're completed. They may also capitalize on so-and-so's strengths, such as his interest in video and film, right? So what's good about this, and it began to happen often, is at first teachers, well, actually they kind of like this because they're not being told what to do, except that meeting, but they're not being told, give them extra time to do this. But teachers would come back and say, well, once I got to see where his problems were, and I realized he knew the information, I just started asking him the questions in our meeting. He knew the answers, so I gave him the good grade. Forget him spending all that time on that work. That was what was important. Now, I'm not saying it's not important for your child to get some work perseverance and know how to do these things. But if the child's not doing well, just telling them to do it or trying to get them to do it is not, you have to start where the youngster is. And I say that to schools also. The idea of accommodations is not forever, this is what we do. But you do accommodations while the child is building the skills. Now, who's teaching the skills? The school should be. So I say that to the teachers. If the child isn't sure how to study, well, each teacher should show the child how to study for their subject, right? So any of those problems, or he doesn't know how to study, teachers should have study guides or whatever. I do not ever more put down, give the kid extra time. Like I said at the very beginning, all you're doing is piling it on them. Because if you really want the child to keep up, you've just got to modify things and just let the child keep moving. I'm sure yes.
Can I add, can you go back a slide?
I don't know.
Press the back arrow instead of the forward arrow.
The back arrow.
Are you clicking or are you using a keyboard?
I'm just clicking.
Okay,
Back arrow. I got it. Like that.
Just so everyone knows, Dr. Katz is my uncle, so I'm allowed to interrupt him like this.
Well, I don't know where you got that idea, Rachel.
Anyway,
but we'll go
so
with it.
because we were talking before about the meetings weekly with kids. So
Yeah.
a lot of times in my practice, I see that the kids aren't turning in assignments because they don't feel they need, there's no accountability. There's no
Right.
reason to turn it in. There's no checkpoints along the way. So it's, hey, you have this research paper due in the middle of December. These are the things you need to do for it. Go and do it. But the kids with ADHD don't have the skills to plan out and sequence how to do these things, chunking the smaller tasks and just organizing the thoughts around it. So this is another reason that meeting with teachers on a weekly basis is helpful, because it can hold them accountable, and it feeds
Right.
into the issue of ADHD that is of a lack of motivation or difficulty motivating. This creates that motivation, the urgency and the deadline.
Yes, and so Rachel is correct. And when parents say, well, if we do all these accommodations, or the school says, how are we going to hold them responsible? They need to be responsible. No, it's not about responsibility. It's about ADHD. And if you just say, this is your assignment, as Rachel was saying, you need to go off and do it, that's not holding them accountable. You know, and what I say is these things wrap the child up, right? Because if the teacher's checking with that child every week or more often if necessary, the child's not going to, quote, get away with things. People are going to see what's happening, and that's very important. And on that motivation thing, that's a major problem with kids with ADHD, and you know, they'll say it all the time. You know, I meant to do this stuff, and then I couldn't do it. You know, I lost my energy. When teachers like bring that up, my response to them is, what are you doing to motivate them? Again, I don't have all the answers off the top. It depends on a lot of things, but it's what are the teachers doing to motivate? It's recommended that the child be given additional external structure and assistance with organization. If the child's having difficulty getting started on tasks, right, persisting in the effort needed to complete them, or with the transition between tasks, it's recommended the teachers break the assignments down into smaller chunks. And one thing is that they give the task one sheet at a time. A lot of kids will say, you know, morning work or whatever the assignment is, they're lost. And like I said at the beginning, the teacher leaves that kid for half an hour and doesn't do anything. That's a problem, you know. So if the child has trouble getting started or is even rushing through assignments, then you give them the first sheet. This is what I want you to do. When you're done, raise your hand, I'll come get it. And here's the next sheet. And then here's the next. And if they're rushing, the teacher has a chance to look at it and say, oh, wait a second, go back on this. So that's where you can slow down that rushing and pace the child. Difficulties with prioritizing, I saw at the time right now. Another one I think is very important. Should Jack obtain a grade below a C on a graded assessment, it's recommended the teacher review the material orally with them. If the child knows the information, they should be given the credit, and aspects of the assessment evaluated to determine why they did not assess Jack accurately. And the school, why do I say a grade below a C? Because the school's not going to guarantee an A, but you know, even a bright kid should at least have a C. I mean, in my mind. So if there's a grade below a C, something's off, something's wrong for the child. And I said the teacher really needs to go over that material with the kid. You just can't leave it there. This is some other things, and I can send these out to people if you'd like, or send them to Ellen, and you can send them out. Providing word banks and answer banks would reduce the demands on working at memory. You know, there's a lot of stuff, you know, you can put the math formulas on the side. The child still needs to know how to use it. Jack doesn't listen and take good notes or complete notes. It's recommended he be provided a copy. So he has a complete and accurate set of notes to study from. Well, he has to show me he's trying. What? No, he doesn't have to show you. Just give him the notes. Is the point to help him learn? Or if you want to, you know, teach him to take notes, that's fine. But while he's learning, you still would need to give him the notes. Or if the school says, well, we don't think note taking is an issue, parents do, you can say, then you want to have it monitored. It's okay to, the school can gather data. They like that. Allow additional time for verbal response. Kids with ADHD, you got to do it. Provide a cue before the student's called up to answer. So some kids, particularly inattentive kids, or kids who have a history of not doing well, so they're shy about answering questions. One thing you could do to kind of get them into it is to say, Mary Beth, tomorrow we're going to be learning about turtles. And I want to ask you the question about how do you know a turtle, what's the difference between a turtle and a tortoise? Okay, look on page 5 or, look online. So listen to me, because when I ask the question of the class, you put up your hand and I'm going to ask you, and you'll already know the answer. That is a good way. Now the kid has to listen because they're going to be called on, but they will know the answer. And that is very positive for a child to be able to do that and be able to show in front of the class what they know. blah, blah, blah. Positive behavioral intervention supports, that's a whole other lecture. But if there are behavioral problems, the school has to, I'm sorry about that. You just don't give consequences. You have to have positive behavioral intervention support. So we had this on positive behavioral supports on an IEP, and the teachers are saying, oh, I tell him good job often. Well, that's positive. That's great. Kid's still not getting his work done. You know, the idea of PBIS is, what's the problem? Well, the main problem is written language. He's having trouble writing. Maybe he needs graphic organizers, but you have to do things to increase those desired behaviors. You work on that. You give them a homework pass when they get something done, but it's not just positive, nice things, but you have to have a system to help the youngster do well. And like I said before, anytime there is a behavioral problem in class, the first thing you have to think about is, what is the child failing at? What is the problem for the child that they're now having behavioral problems in the class? It's generally an academic issue. Okay. We talk about relationships. Some of this stuff, if you're familiar with Ross Green, again, about engaging kids in discussions, this is one of the things we talk about is, and I said this in a meeting today, it's not what we think the child wants. They're saying, well, he's having problems. Why don't we move his lunch table, so he's sitting somewhere else? Well, that may be okay, but you need to check with the child, because if you keep moving him around, the kids are going to really think there's something wrong with him. What is the child comfortable with? Does the child have any ideas that might be helpful? So I think that's very important. And then I always have this, at least on the end of my report, as difficulties with ADHD vary depending on the circumstances and demands of the environment that they're in, it's important that the accommodations be monitored and modified as necessary. So, what happens, it makes ADHD kids so interesting, is you can really work on something, and how long does it last? 2 weeks, right? And then something shifts, but whatever reinforcer we're using changes. It's going to change. And, the teachers need to understand that it's an ongoing process, right? That something changes, teacher changes, or they start another part of the work. What was working may not work again, and you may have to come back and work on those accommodations again. And that's what happens, so I think that's very important. So this is me. You all have been so quiet and so attentive, or at least quiet, or I guess you've been muted. How would you all like to take care of questions? Ellen, Jenny?
Oftentimes we ask people to put a question in the chat or to raise a hand. If you go to where it says reactions, there's a raise hand icon. And if you raise your hand, then Jeff can call on you.
And what I do want to say a general thing. When I graduated with my degree in psychology, what you'll know, what you've learned is enough to know what you don't know, right? And then you spend the rest of your career learning those things. So, I have given you, a brief look at these things, right? And I want to whet your appetites that there are things you can do there, and there are books, and I can direct, there are other resources. Chad has a lot of resources. This COVID makes things very different too. And one thing I want to mention about COVID very quickly, I was in 2 meetings last week. One was a high school, and then another one was a middle school in another district. And they were finally understanding about the child with the ADHD. And the high school assistant principal said, you know, we are dealing with all the kids are traumatized. They've been out of school, now they're in school, they have lost their academics. You know, ninth grade, generally the kids will come in with about the same level of skill. They are all over the place. And that's not just the academic side, that's also the social side. They've lost that. And then this other person said that they're spending most of the time dealing with the emotional fallout of COVID. The one in the middle school said that they've changed the schedule so that the first half hour in the morning is in homeroom, and they have a lesson to be taught every day, half an hour, social skills. And this is for all the kids because they have lost so much because of COVID. And it just kind of like, wow, that struck me, you know. So Laura, you have your hand up.
Hi.
Hi.
Good evening. So I just have a question because I'm currently working with a family and the daughter has no diagnosis and she's an honor roll student and she seems to be struggling, or mom says that she always struggled with math. So mom was trying to push for an IEP with the only accommodation being math because the girl does have straight A's in all her other classes. But the school's very hesitant to even give her an appointment for an IEP. So do you recommend that she should just have a 504 instead for now?
No, what grade is she in?
The junior in high school. So I feel like
I'm sorry.
she's a junior in high school.
Okay. So, so to me, as far as you know, she actually does not do so well in math.
Yeah, and mom says that apparently this has always been an issue for her, but I guess now that she's in, I think she's like in pre-cal, which is hard for everyone,
Sure.
but more so for someone who feels that they have like some type of learning disability with math.
Okay. So what I would say is, first of all, I don't think a 504 is really going to be helpful because you're talking about more of probably a learning disability. It's like kids with ADHD, oftentimes all of their grades are a little bit lower than you'd expect them to be. If they also
Right.
have a learning disability, you'll have, you know, one that's going to be maybe worse. But so what happens is, and I don't know, you know, what you do with them, but part of it is that the letter that the parents should write to the school, and they should probably put in writing is, I suspect that my child has a learning disability, and I would like to have a special education meeting or IEP because I think they have a learning disability. Again, that's all they're supposed to have to do. The school will have a meeting with them within 2 weeks. It's just required, you know, and it's not for the AP to say, well, I think the record looks fine. Well, that's not his job. His job is to set the meeting. But she would want to come in with some evidence, like, look, all through here, you know, this is what we've seen in school. And you can see that she does really well in these subjects here, but it's the math that's causing problems. Well, maybe she shouldn't be taking calculus. I don't know. But until we have an evaluation, we don't know either. That's the whole point, is what you want is not an IEP. What you want is a comprehensive evaluation that the school does to see what her cognitive functioning is and what her functioning is in all of the academic areas. And then you can make a determination whether or not she might have a learning disability. Does that make sense?
And yes, it does. And does the 504 or an IEP follow into college?
No. So the way it works is that in colleges, by the way, it's not that difficult, these things, but most every college will give, colleges give accommodations. If you have a learning disability, they can give accommodations. They don't teach. In others, they're not going to rectify a learning disability, but they'll do an accommodation. Oftentimes, it could be math. Oftentimes, it's foreign language, if a foreign language is required. If there's a learning disability, they can take off that foreign language requirement. So they do accommodations in colleges. And if somebody has a math disability, you know, you can get use of a calculator, or they can, you know, take more of the basic math. They can get extra help. I mean, all colleges have a math lab or a writing lab. I mean, you have to kind of work it with them. But I find that the college disability services offices are very willing to help. And a lot of them offer academic coaching, so that you get somebody who's helping with the organization and all those sorts of things. So now the college, they're going to want to know that there's documentation. And any college, if you go to the disabilities page, will show you what documentation they need for ADHD or learning disability or emotional disability. But they're very willing to help because they want kids to do well. So if you don't, you know, have an IEP in high school, like a math disability, and I see a lot of kids like this actually, who they get to a point even in college where something's not working, they'll ask me to do a psychoeducational evaluation to determine if they have a learning disability, and if they do, then I can make recommendations, and then you know, the school's going to be helpful with it. I should get somebody else. Can I jump? Can I go to Melissa? Hello.
Hi, sorry.
Yes.
So my child has an IEP. He's in the first grade, and we're having a bit of an issue right now. The school sent him for an auditory processing, what they thought was an auditory processing disorder, but they ruled that out. He's having a difficult time just with directions in general, getting very frustrated. So the child study team is going to have a meeting, well, a planning meeting with me in another week, and then they're gonna do a reevaluation. Can you recommend any like testing that I should be asking for? I'm kind of like at a loss here as to what I should be asking for here, because I obviously want to get to the bottom of why he's having a hard time with anything in his left side. That's what the audiologist had said, but any information coming from his left side going through. Now his hearing is fine, but it's like, it's as if he was not told anything from his left ear. Like he's just getting like, if you say cat, he says bat. He's just mixing it all
But
up.
if you said it into the right ear, would he get it correctly?
Yes. Like he's a little bit better in the right ear, but not 100%. But the left is a huge problem. It's like as if he has heard nothing.
Are there any other left-sided problems?
No, not that I know of.
So they did an auditory processing evaluation, right?
They did.
Okay.
They sent us out of district for that. So I'm wondering, like, because I feel as though they're kind of like dropping the ball on me. They're just like, you know, I had asked his teacher, I'm like, so how's he doing? And she was kind of like, oh, he's fine. And I was like, well, that wasn't the case like 3 weeks ago when I spoke to you on the phone. You called me frantically saying that he was having such a difficult time in school. Now all of a sudden, because we ruled this out, he's fine. So then, you know,
Right. No, you're right about that. Now my thought to you is, and I'm not a physician, I'm a psychologist, but I wonder that there's some medical issue going on. And one thing I would say is you may need to see an ENT, eye, nose, throat, and let them do an evaluation. I mean, he could have wax in his ear, but I imagine that the audiologist would have looked at that. But
right.
I would say you may need to talk to his physician what might be going on. But I do agree with you. Like, so for an IEP, maybe he's not eligible because maybe it's not a learning issue in the sense that he has a learning disability. But if there's deafness, he could have if he needs. But it could be a 504 issue if he does have that issue. You know, like kids with auditory processing disorder, you know, they could have a speaker system in the classroom to make sure that the sound is getting to the kid well.
See, I wonder if they have never even mentioned that to me, because he's in an LD classroom for half the time. And they never even told me that there is any sort of speaker
What-
available, like
Can I
where the
ask what
teacher
his, can I ask what the IEP is for?
IEP is just for his ADHD of
Okay,
his
okay.
diagnosis. Yeah.
Okay, but you do have a right to request the evaluation that you did, and also, by the way, everybody, if the school does an evaluation and you disagree with it for any reason, in fact, you don't have to have a reason. You just say, I disagree. You are entitled to an independent educational evaluation, and the school pays for it to a person of your choosing, as long as they have the credentials. So if they do
What
an
is this called? I'm sorry.
an independent educational evaluation. And the little booklet they give you about special education, it's in there. You have a right to that. Anytime the school does an evaluation that you sign consent for, I consent for you to do this evaluation, you have a right for an independent educational evaluation if you disagree. So Melissa, and you can certainly say, well, do you all think that this is ADHD related? And I would say, well, if it's only on this side, it doesn't sound, just ADHD. But I think you may need to check with the physician and see what that might be about. Okay.
His developmental or just his?
That's so to me that it's just on that side. There could be an inner ear deformity, or I mean, I have no idea, but if you're saying he does better on the other ear, but sometimes not so great, well, that could be inattention, but you would think it'd be pretty much the same in both ears. Yeah. So I see somebody else with their hand up.
Sure.
Lara Trinovsky.
Hi, how are you?
Good.
My question is, what if they go to a private school? What are they held to the same standards as the public school?
Well, I'm not sure you mean held to the same standards.
Well, I mean, like, what are my son is diagnosed with ADHD, and what is he entitled to as far as like the meetings that you're talking about and what the school is required to do?
Yeah. So it's very interesting you asked that. One of the people in the board of directors of CHAD right now happens to be the president and chief executive officer of the Association of Independent Schools.
Okay.
In Virginia, there's a Virginia Association of Independent Schools, but she is the national person. And we've had this conversation because in my area, the best private school in the area, they don't do accommodations.
Okay.
And I spoke to the Virginia person. Donna had given me her name. And if the school receives federal money, even for cheese, then they have to follow the federal regulations. But if they don't, they are not required to make these kinds of accommodations. And Donna and I at the last board meeting, we were talking about this. She believes, I mean, she's interested in ADHD. She has a child with ADHD. She believes that it's in the best interest of private schools to serve kids with ADHD. And because they lose good kids and bright kids because they don't take the time to do accommodations and to work with the kid. I know, and I can talk about Virginia. In Virginia, the Catholic Diocese in Richmond, they have put out a couple of years ago a booklet saying that the Catholic schools will provide accommodations.
Okay.
But it's not as clean as it is. I mean, with public schools, you've got federal regulations behind you, and there's laws and ways to complain and all that kind of stuff. But even the parochial, like Catholic school, they could still be a problem.
Okay, it is a Catholic school, and we have met with them before, but it was interesting that you said about the federal aspect, because when I met with them, it was done through, I'm in New Jersey, and it was Bergen County Special Services. That was who we were dealing with. So it was
interesting,
state related, but I actually live over the border in New York. So that actually opens up a whole other can of worms because certain things they were saying they couldn't accommodate because I'm not a resident of New Jersey.
Well, one thing I'll tell you, in the state of Virginia, I assume it's in other places too. If I go to the Virginia Department of Education, Special Education, there's an Office of Dispute Resolution. And they have a person assigned to our region, as they do every region of the state. And their job is to deal with complaints against the schools with special education, not 504 necessarily. But I use them because if the school says, well, we can't do this or that, then I'll call the Office of Dispute Resolution and I'll ask, this is what the school is telling me. Does this make sense?
Okay.
And oftentimes they'll say, well, yeah, regulatory, yeah, they can say that. Or sometimes they'll say, no, in fact, you want us to call the school and talk to them about this.
Okay.
That'd be fun. Funny thing, then the school kind of gets what they're supposed to be doing. So use those resources. And I don't know if you all, by the way, in your area have Ph.D, parents and educators and teachers. So there may be some other organizations in your states that, like in our area, Ph.D is in the state of Virginia. They train parents and also, in special ed issues. Also, and I believe this is federal wise, that every school district is supposed to have a parent resource center. You all familiar with the Parent Resource Center? And they're supposed to advise parents on kind of what the rules are, that they're supposed to provide parents the information. Now, some of the districts down here, you can get information from the Parent Resource Center, but they won't go to a meeting with you. The Virginia Beach Parent Resource Center, the one who runs it, she's really good. And she'll go to a meeting and talk about what the regulations mean. So you should check into the Parent Resource Center.
Okay.
And Lara, with some of your questions, you may not want to identify yourself, but you can call the school district and say, I'm a little confused about things, or call another school district and not mess with yours yet until you have more information about how would they handle the situation. You know what I mean? So,
yeah.
Does this make sense? So I would kind of gather some information around to see how different districts would handle that, because you may find out they may be right. You may have to find another way to kind of get in.
Okay. All right. Thank you.
You're very welcome.
It is getting late.
Yes.
It looks.
Oh, you want me to stop talking?
Well, I do see that Sue had a question.
Okay.
Also about a child in parochial school and Catholic school.
Yeah, it actually wasn't a question. It was just more of an observation because I thought. Can you hear me okay?
Yes, great.
Okay, because both my twins started off in Catholic school, and as one child became more severe with his ADHD, we realized that the Catholic school did all they could through the 504 plan, but it wasn't really accommodating enough for my one son who has severe ADHD, while the other one has mild. So although it was a little bit more of a inconvenience for me, I've, sons in two different school districts, really just so they could accommodate their ADHD effectively in school. And so I realized that a 504 plan is great for, some children probably if their levels are being accommodated effectively, but for other children, it may not be enough.
Absolutely.
And I learned that the hard way. Last year was a really tough year for my one son who has it severely, and he's really striving much better this year because I learned that the IEP was much more accommodating for what his needs were.
Yeah. And I tend to tell parents in schools that, if the teacher says, look, 25 hours a day, I'm working for your child, I can't do more, then I say, fine. I don't have a problem with a kid getting an IEP, with the ADHD. But generally, I would like to know that the school's working at it and working at it well. But I don't want the kid to suffer half a year just because I want to see if they can handle the 504. So you're right. If they need it, they need it, and that's fine. Not a problem.
I was just observing that one.
So
Thank
thank you, Sue. Thank you. That was interesting to see that not
Mhm.
every solution works for every kid. It's not
Correct.
All right.
Even
That's
in
not
the same
fair.
house.
even the same, even
Absolutely.
the twins, right? So we're going to have to wind up. This is going to be, this was recorded. And Jeff, if you would be so good as to send me your slides, we will
I'll do
post
that.
the slides and the recording on our website. Just look up, because I don't have it memorized, Bergen County Chad, and you'll see under links, I think. Or you
And
can-
Ellen, I'll send you the whole slideshow, but I did start, 2/3 of the way down.
But there's so much valuable information
Huh.
there, Jeff, and people
Yeah.
can pick and choose. And it's the
Absolutely.
kind of material, as you were talking, that I really wanted to take the time to digest and to read,
Yes.
and I'm imagining other people might have that same experience.
Yeah.
So thank you. I mean, yes, you could have gone on talking, and maybe you'll come back and you'll talk to us about something else in the future. That would be
I
fantastic.
don't mind at all.
But thank you so very much. And
Thank you.
thank you all who are here for coming and for your questions. And I hope we see you next month, January 7th, for some learning about cognitive therapy and behavior management with kids. All right. Good night.
Thank you all. Thanks for inviting me.
Thank you.
Thanks.
Bye-bye.
Thank
Thank
you.
Bye-bye.
for coming.